Good morning. Today I would like to discuss with you this very important paper just published in the New England Journal of Medicine in July 29, 2021. The title is Long-Term Complication in Youth Onset Type 2 Diabetes. So this is a follow-up of a randomized clinical trial in young men and women. At the beginning of the study, their mean age was 26.4 years, and they've been followed up for 13.3 years. So when they finished the study, on average, these individuals were approximately 40 years old. So as you know, type 2 diabetes doesn't start immediately. There is many, many years, around 10, 15 years of metabolic molecular changes that are finally ending up in type 2 diabetes. So probably the disease in these 26 years old started when they were 10 years old. And this is important. We're going to discuss about it. Anyway, the important message of this paper is that after 13 years on average of type 2 diabetes, 67% of these young adults had hypertension, 52% dyslipidemia, so low HDL cholesterol, high triglycerides, triglyceride-rich lipoproteins, and hypertension, dyslipidemia, and type 2 diabetes are three major risk factors for myocardial infarction, stroke, and heart failure. Not only that, they 55% had diabetic nephropathy that eventually is going to lead to dialysis and kidney transplantation, especially because these people, they are only 40 years old. So they have another 20, 30 years of type 2 diabetes in front of them. And 32%, they had diabetic neuropathy, a disease of the nerves, of the nervous system, peripheral nervous system. And 51%, they develop diabetic retinopathy, so a disease of the retina that may lead to blindness. This is terrible. And we knew that, but these data are clearly confirming that there is an unsustainable epidemic of chronic disease that is going on in many Western and developing countries because of the epidemic of abdominal obesity starting in children and developing over years in major complications. Again, 60% of these 40 years old individual with 13 years of type 2 diabetes had at least one major complication, and 30% had two or more complications at 40 years when they were 40 years old. So these are terrible, frightening data, and I'm going to explain you why in a second. The reason is that, as you can see here, the proportion of children and teenagers that are overweight and obese is increasing not only in US, where approximately 30% of kids, and there is a growing number of kids, with obesity, a central obesity, but also in Australia, in Italy now we have 32%, and many other developed countries. And if we look at the data, for example, in Italy, there is a gradient, and in South Italy, where kids are more sedentary, and they eat more refined and processed food, they have a higher rate of overweight and obesity. For example, in certain regions like Calabria, Campania, Puglia, almost 50% of children between 8 and 9 years, they are either overweight or obese. And there are several reasons, but one of the most important is that these kids are eating lots of sweets and snacks and soda and candies, and they are not having enough beans, whole grains, and minimally processed whole grains, but they have refined carbs, and they're not eating enough fruits and vegetables. They eat a lot of animal products. They are sedentary, 50%, almost 50%. They spend more than 2 hours a day in front of a TV or a PlayStation or a tablet. And what is worst, based on this survey, Italian survey called Occhio Salute in 2020, is that 40% of mothers and fathers of these overweight or obese kids, they think their children are normal weight or even underweight. And 59% of mothers think that their kids who are overweight, they are doing enough physical activity. And 70%, they think that the food they're consuming is not excessive. So we need to change this, because this is leading clearly, based on this study and other studies, to an epidemic of chronic disease that is totally unsustainable socially, financially, and environmentally. So we know that everywhere, again, you see this data not only in US that is leading, but in England, Canada, Spain, Austria, Australia, France, Korea, Japan, everywhere there is an increase in the proportions of overweight and obese individuals, that in part is in line with the increase in the size of soft drinks, that soda that people are consuming, with the increased size in hamburger, French fries, consumption of unhealthy, super refined bagels and cheeseburger, French fries, soda. People are exposed to all these convenient, super refined, ultra processed food, rich in unhealthy carbs and animal proteins, dairy and salami, and unhealthy vegetable oils. Buy one, get one free. A lot of snacks is everywhere. You go to a supermarket and a grocery, and there are all these unhealthy snacks, sweety and salty, full of partially hydrogenated fat everywhere in front of people. And there's been a huge increase in animal consumption, as you can see here, in beef and pork and chicken and many other animal products rich in methionine and branching amino acids that we know are partly associated with the epidemic of obesity and type 2 diabetes, based on many studies. So this is a study by Frank Hu Willett at Harvard, published in New England Journal of Medicine in 2011, showing that the consumption of potato chips, fries, processed meat, and processed meat are highly associated with weight gain. In contrast, vegetable, nuts, whole grains, fruits, and yogurt are inversely associated with weight gain. And among the beverages, soda, sugar sweetened beverages, and 100% fruit juices are also highly correlated with weight gain and obesity. In contrast, we know that even in people with type 2 diabetes, these are the results of the direct UK randomized clinical trial. Even in people who already have type 2 diabetes and are taking drugs, Roy Taylor has shown that 86% of people who have lost more than 15 kilos, they are free of diabetes and they are not taking any more medication for diabetes. And other studies have shown that even fatty liver disease and fibrosis can be reversed in people who have lost more than 10% of their body weight. And remember that fatty liver disease and diabetes are just part of a major change in a metabolic hormonal inflammatory substrate that is leading to multiple chronic disease. So this abdominal obesity with changes in diet composition, excessive caloric intake, sedentary lifestyle, mental stress, smoking, pollution, lack of sleep or sleep fragmentation, they are impacting on a range of metabolic molecular pathways that are concomitantly leading to some of the most common cancer: breast, colon, pancreatic, endometrial, esophageal, kidney, and many others that are associated with unhealthy lifestyle. Again, fatty liver disease, coronary heart disease, stroke, certain type of dementia, especially vascular dementia, but probably this also is playing a role in Alzheimer's disease. We are studying that. Some of the most common kidney disease, diabetic, hypertensive, atherosclerotic kidney disease, and many other diseases, heart failure, vascular disease, atrial fibrillation, and many other ones have a common metabolic substrate that can be addressed and changed by changing lifestyle. We know that even in young individuals, this is a result of a randomized clinical trial, calorie phase 2, that we did in US. These were 20 to 50 years old, healthy, relatively healthy individuals, men and women, with a BMI between 22 and 28, so non-obese individuals, and a moderate 13% calorie restriction resulting in 8% weight loss caused a marked improvement in all cardiometabolic risk factors. There was a reduction in LDL cholesterol, an increase in HDL cholesterol, reduction in systolic blood pressure, diastolic blood pressure, a major improvement in the metabolic syndrome score, a major improvement in insulin sensitivity. That is one of the major drivers of type 2 diabetes. There was a major reduction in inflammation, C-reactive protein, TNF-alpha, white blood cells, a significant reduction in oxidative stress measured by F2 isoprostanes. So we just published a perspective article in PLOS Medicine with Alessio Fasano, Yap-Seng Chong, Paolo Vinese, and Walter Willett, denouncing this unsustainable approach to healthcare. It's more sick care than healthcare, because we know that this idea where we wait for people to get sick is totally unsustainable. We need to change this. We need to change how we approach diseases. We cannot wait for millions of people that engage in an healthy lifestyle to come to our medical practices and hospitals with symptoms of chronic disease, like in this study in New England, where people, because for many years they've been obese and had type 2 diabetes, then they develop kidney disease, retinopathy, neuropathy, cardiovascular disease, and many other diseases like cancers. And when we know that these diseases are treatable, this is financially unsustainable, is increasing inequality, and has, as we discuss in this perspective article, has huge impacts on environmental health as well, because millions of people taking medications, the byproducts of this medication, they end up in our aquifers, in our fish, in our vegetables. The excessive consumption of animal products has impact on global warming, on deforestation, on pollution of land and rivers, and because of pesticides and fertilizer like nitrogen, phosphorus. There is an increase in antibiotic resistance due to intensive animal farming. There is an increase in the risk of developing new viral, like the avian virus, coming up of this intensive animal farming. So there is a number of problems that can develop because of this wrong approach. So medicine is fantastic, but we need to switch. We need to move from a sick care system to a balanced prevention and treatment, personalized treatment, where we prevent disease by several steps, as we discuss in this article, that is, first of all, education in primary, secondary, university. We have to teach people to stay healthy, to explain them what are the mechanisms through which diet and exercise and other lifestyle intervention are inhibiting the accumulation of molecular damage, leading to multiple chronic diseases. And we need to change legislation about healthy food, unhealthy food, and advertisement subsidies to certain industry who are producing unhealthy products and unhealthy agriculture, pollution. And there are so many things we can do because we have the knowledge and the technology to transform this world, and we should work together internationally to try to solve these looming crises of global warming, deforestation, destruction of topsoil, pollution of land, air, and rivers, seas, and these unsustainable healthcare crises due to unhealthy lifestyle leading to multiple chronic disease, like in this paper of New England, that they're going to be untreatable and they're going to overwhelm our medical systems and make our healthcare systems unsustainable. If you want to follow me, I post videos about important papers about my research on my YouTube channel. Then I post articles on Twitter, LinkedIn, and Facebook. And I also have published, apart from my scientific papers that you can find in Google Scholar, Luigi Fontana, Google Scholar, I have also published several books in different languages, and some are also being translated now in Chinese and others, on what we know and what can be done to improve our health and promote healthy longevity. Thank you for your attention.